In a sense, what you're saying, this could be the dying embers of the pandemic, where the virus naturally must evolve and mutate in order to evade vaccines, in order to become so innocuous that it can almost become symbiotic within the human population. And the government, by rolling out its vaccination campaign, could be preventing something that transversely could actually be more productive than the vaccination campaign.
I don't think it will prevent it, because looking at the data we've got from all these people that have caught it that are already vaccinated, doesn't seem to make any difference whether you're vaccinated or not, whether you catch it. The important thing is that it's a very mild disease, it would seem so far. It's probably going to be 2 weeks, maximum of 3 weeks, till we really know how it starts to affect a European, maybe older population. But I think at the moment we should err on the side that this is positive news, not negative. So I wouldn't have said to the government, just take all restrictions away, but I wouldn't have said put any extra restrictions in. I would have just waited to see.
But is the government perhaps not behaving with pragmatism here, while there are still so many unknown unknowns, you know, in terms of we must wait and see how this affects the European population? We think that it causes a much milder strain. I mean, surely in order to get to the bottom of that checklist clinically, medically, empirically, that perhaps the government are being just prudent in exercising a degree of caution first?
No, I think what it is they're doing a something must be done attitude. And what they're doing is something, so they're doing it. But there's no evidence that it's going to make any difference either way. I mean, the Health Secretary stood up in Parliament one day last week and made a very strange statement along the lines of, it looks like this new variant can evade the vaccines, therefore get your vaccine booster. Well, that's just completely illogical.